All right, next up, Dr. Tom O'Brien. In this presentation, Dr. O'Brien details the underlying cause of many hormonal issues and why most doctors will never tell you about this. As you know, the list of health problems related to diet are staggering, but there's one food that Dr. O'Brien really doesn't like. So we'll talk about that in just a moment. We'll also explore the importance of the gut-liver axis and how this can help you to avoid many health problems. Are you confused about gluten? Well, after listening to this presentation, you won't be. And you'll learn exactly how to adjust your diet for better health. And finally, with liver cancer cases on the rise, we'll expose a warning that most oncologists fail to recognize. Enjoy my exclusive interview with Dr. Tom O'Brien. So Tom, I know you've been at this for 40 plus years, talking to people about how to live a healthier life. And for sure, most people have seen you talk about gluten sensitivity and the problems with wheat these days. But what alerted you to this problem at the beginning, you know?
When I was an intern, my wife and I were trying to get pregnant. We couldn't get pregnant. So I called the 7 most famous doctors I'd ever heard of, and holistic doctors. And I was able to talk to each of them, and I asked them, what do you do for infertility? They all told me what they do, and I wrote it down and put a program together. We were pregnant in 6 weeks. My neighbors in married housing heard about this. We lived on campus. And they had been through artificial insemination and nothing had worked for them. And they asked if I'd work with them. And I said, well, I don't think it's going to hurt you. Okay. She was pregnant in 3 months. So we were hot to trot. We were ready to go, and now we're 3, 4, 5 months pregnant, telling our friends, very happy. And our friends would tell their sister in Wisconsin who was having fertility problems. And we were in Chicago at the time. I was in school. And somebody would drive down from Chicago or from Wisconsin, and I would treat them in my dorm room. And there's not much in medicine that's all or every, but this isn't every. In my clinical experience, this is every. Every person, male or female, that has problems with hormones, whether it's infertility, or it's miscarriages, or it's low sperm count, or it's premature ejaculations, or menstrual cramps, or abnormal cycles, every single person has as a contributor to their problem that they're eating foods that they don't know are a problem for them. The foods aren't making them sick. They don't get stomach pains, but it's causing a problem with an imbalance in their hormones. And consistently, the most common food we'd find was wheat. So I started studying the literature about wheat and wheat sensitivity. And it was all about celiac disease back in the 1970s and 1980s, and all the research. There's over 20,000 articles on this. There's no question if you have the genes for celiac. But now we know, the study started coming out about 1976, that you can have a problem with wheat without having celiac disease. And now we know it's much more prevalent to have a wheat-related disorder, that's the correct term for it, is a wheat-related disorder that's not at all involved with celiac disease.
I think it's a very tricky thing. I was thinking a lot about our conversation today together. It's a very tricky thing to talk to people about this, isn't it? Because like what you said, if somebody is not feeling really, really sick, they don't think eating wheat or gluten is really a problem at all. And let me give you an example, though. I just can't get this out of my head because it literally happened a week before we were going to have a conversation. Talking to somebody, she's probably about 25 years old, and we were talking about you coming in and going to do this interview about gluten and wheat and how it affects the whole body. I'm doing this liver program, on and on and on. She says, oh, that sounds very interesting. She says, I don't think I'm sensitive to wheat products at all, although my stomach does hurt me when I eat it. I kid you not. She literally said both of those things.
And this is a
in one
healthcare
sentence.
practitioner?
No, not a healthcare provider, just a young gal working out there at a shopping center who I was having a conversation with. But what I'm bringing it up for is I just felt like, wow, that really hit home for me. What a huge disconnect that here it is, someone actually does sense that eating a certain kinds of foods cause her some pain, but at the same time, she said, I don't really think I'm sensitive to it. It's incredible, right?
That is. The lucky ones are the ones that have gut symptoms when they eat it. The unlucky ones are the ones that don't, because they can't tell. But the ratio in the science, the ratio is 8-1. For every one person that has gut symptoms when they eat wheat, there are 8 who don't have gut symptoms but have a problem. And it's manifesting in their brain, or in their joints, or in their skin, or in their hair, or in their thyroid, or in their liver, or their kidneys. It just depends on where their genetic vulnerability is as to where it manifests. But when we all know now, almost everyone has heard, that inflammation is the mechanism for most degenerative diseases. And if there's only one thing you're going to do, what is it? Live an anti-inflammatory lifestyle. Well, what does that mean? Well, it takes a lifetime to learn, all of the possible components to an anti-inflammatory lifestyle. The rule is stop throwing gasoline on the fire. And if you have a sensitivity to wheat, it's gasoline on the fire. And if your genetic vulnerability is to have a compromised or a weak thyroid, you pull at a chain, it always breaks at the weakest link. It's at one end, the middle, the other end. It's your heart, your brain, your gut, your liver, your thyroid. Wherever your weak link is, that's where the chain's going to break. Don't pull on the chain so hard. Well, what does that mean? Don't have so much inflammation. Well, how do I do that? Find out what it is that's gasoline on the fire in your life and stop throwing gasoline on the fire.
Yeah, no doubt. Throughout all these conversations I've had, Tom, a lot of the practitioners, they get it. People watching us, they get it as well. There's such a disconnect, I think, because the mainstream message is, if you have inflammation, take an anti-inflammatory. If you have a stomach problem, we have to examine so closely the stomach. But they're not looking at the big picture like what you're suggesting already. So let's just get into it a little bit more. I have you here because I consider you one of, if not the top expert when it comes to warning people about the dangers of eating wheat and gluten. Talk about how the gut itself is related to liver function.
If you drop an apple on the ground and you pick it up, you wipe it off and you eat it, if there's any dirt on the apple, bacteria on the apple, that can get into your bloodstream. Everything you eat your intestines is a tube. It starts at the mouth, goes to the other end, it's 20, 25 feet long, kind of winds around in the middle there, The inside of the tube is lined with cheesecloth. And the cheesecloth only lets really small molecules get through. This is a very important point. So when you eat food, that bite of roast beef can't get into your bloodstream. Our enzymes have to break it down smaller and smaller and smaller and smaller until it's small enough to get through the cheesecloth into the bloodstream. Now, everything that goes through the cheesecloth into the bloodstream in the gut goes to the liver. That's the only place it can go. It can't go anywhere else. There's no other path. Everything goes to the liver. Why? Your liver's an oil filter, and it filters in case you dropped an apple, it got some bacteria on it, wiped it off, but some bacteria, eat it, gets into your bloodstream. The liver filters anything that's coming into the blood that shouldn't be there, that should not go to the rest of the body. Liver's got, depending on the article you read, from 350 to 500 different functions in our body, but a primary one, the first one, is that it's an oil filter. Now, what's an oil filter? An oil filter it's like a honeycomb, a beehive. And there's hundreds and thousands, actually, thousands and thousands of honeycombs. And the blood goes through the honeycombs. The inside of the honeycomb is lined with a cheesecloth also that filter stuff. So blood's coming in, it's got some crud in it. It goes through the liver, goes through the honeycomb, and comes out the other side. And whatever it filters, whatever it catches, goes out with the bile back into the gut to be eliminated. We wouldn't be here if we didn't have that system. It's a very important system. Now, when the blood comes out from the liver, where does it go? It goes to your whole body, but the first place it goes is right past the skin between your shoulder blades. It's right behind the liver. And so the blood goes there first. So here's a really simple test to see if you've got a dirty oil filter, right? If you press on your back between the shoulder blades on the left side and then on the right side, you press on the back and you take your finger away, there's a little fingerprint there. And you count to see how long does it take for the blood to get back in there. 1 second, 2, 1,000, 2, 1,000, 3, 1,000. And it should take a second, maybe 2. Most people in our culture today, it'll be 4 seconds, 5, 7 seconds, 8 seconds, which means the blood's really slow in flowing through that area. So you press there and you count. Within a second or two, it should be right back to the color of the skin. But when you've got a congested oil filter, a dirty oil filter, the blood's slow coming out of the liver. It's backed up there, but it's kind of blocked a bit, almost like being dammed up a bit. And so you'll get a liver blemish that's 4 seconds, 5 seconds, 8 seconds. What that means is you got a dirty oil filter. You need to detox your liver.
Let me clarify something for a moment, though. Do you say that that fingerprint test, if you will, is right on the back only, or can you do it in other parts of the body?
It's always been represented as in between the shoulder blades, because that's where the blood flow is directly coming out from the liver. I imagine if you do it somewhere else in the body, it's suggestive of the blood flow in that area, but I don't have any diagnostic indicators for that.
It's such a great, simple test. And also to clarify, what I find most interesting about this and important to point out is that if people see that there is that sluggish sign, if you will, where the blood is not rushing back quick enough and getting back to normal, it doesn't necessarily mean that the person has any other kinds of overt symptoms, right? It's not like they could be in a lot of pain. And
you can be fine. I'm fine. And they don't know. But when you've got a dirty oil filter with the hundreds of functions that it has, it's going to impact on liver function. And it's a nice biomarker of improvement. So if your daughter, your teenage daughter, has a liver blemish of 8 seconds, you say, oh, okay, so we've got some kind of congestion here. We need to detox the liver. And in 3 months, she has a liver blemish of 4 seconds. You've cut it in half. It's not perfect yet, but you're on the right path. So it's a nice, general, not real target specific, let me say again. It's a nice, general indicator of a problem and also of when you're improving.
And absolutely, what you're talking about backing up and becoming sluggish, really are the beginning stages. When I was studying natural medicine 30 plus years ago for me, I found it really odd, because it was never in my conventional training, that they would say chronic fatigue is the first sign of disease. But in a certain sense, this test that you just gave for all of us to try is something even before a chronic fatigue state that says, look, if you don't address this as you age, as you get exposed to more and more toxins, this becomes more problematic.
Well, that's a really good point, Jonathan, because chronic fatigue was represented as the first immobilizing symptom, right? It's not the first indicator, it's an immobilizing symptom. You know, there's 2 ways to measure the temperature in the engine of your car. In some cars, the hot light comes on. And if the hot light comes on, you go, oh my goodness. And you know you have to pull over really soon or you're going to blow up the engine, right? And no one pulls over, turns off the car, gets under the dashboard, finds the wire that goes to the hot light, cuts the wire, starts the car, sees the hot light's not on anymore, and drives away thinking everything's okay, right? But that's what medicine does, and sometimes you need some medicine. But the other way of measuring the temperature in the engine of your car is a temperature gauge. And you slowly can see it start to climb before it gets into the red zone, right? 1986, we had a Chrysler minivan, 2 kids, young kids, and summer vacation. We lived in Chicago. Summer vacation in Michigan, coming back in August, a 90-90 day, 90-degree temperature, 90% humidity. One of those hot August days, right? So we're driving down the highway, 70 miles an hour, air conditioning on, listening to some music, kids in the back are playing, and I see that the temperature gauge is slowly starting to climb on the dashboard. And I say, oh no. It gets up to the red zone. I say, oh no. My wife says, what? And I said, oh, the engine's overheating. Don't worry, it'll be okay. But what did I do? Slowed down to 55, turned off the air conditioning to take the load off the engine, had to roll down the windows because it was so hot, listen to the kids complain about how hot it was, but we made it home without getting stuck in Gary, Indiana, right? We made it home, the engine didn't overheat because I saw the biomarker. And I addressed the biomarker, the problem causing that biomarker before the engine overheated. Chronic fatigue is the end point. All of the symptoms that you get with liver problems are the end point of an ongoing imbalance that's occurring.
Let's get into it a little bit more now about how you had mentioned briefly this whole cycle that you described, which is really simple yet elegant at the same time. That as we're eating, it's going into the gut, then it gets through the gut, goes into the liver. But just talk a little bit more about what happens, I should say, when the liver gets what it gets, and then it's transferring it back into the gut again, right? How does that work?
We have 4 different immune systems in our body. We have the immune system of the gut, the largest one, about 70% of our immune system's in the gut. We have the immune system of the liver. The Kupfner cells are a very different immune system. We have the immune system of our bloodstream. That's what antibodies are and white blood cells. And then we have the immune system of our brain. And the immune system of the liver is specifically designed to protect us. It's activated when something that we've eaten or drank has gotten through the cheesecloth and the lining of the gut into the bloodstream. And once again, everything goes first to the liver, nowhere else. And if something got in there that shouldn't be there, it activates the immune system of the liver. Now you start getting inflammation in the liver. And it's designed to kill, to destroy whatever got in there that shouldn't be there. That inflammation goes into your bloodstream. That systemic inflammation now can cause problems anywhere in your body, absolutely anywhere in your body. So the relationship between the gut-liver axis, there's a number of research papers on the gut-liver axis. That relationship is an integral one because anything in the gut, if it gets through the cheesecloth and the lining of the intestines, it's going to the liver first. And we know then when you've got an abnormal microbiome in your gut, that abnormal microbiome creates products, kind of like exhaust, right? And the exhaust gets into the bloodstream, goes right to the liver. That exhaust activates the inflammatory cascade in your liver. Now you start increasing your liver enzymes. And when that happens with wheat, Mayo Clinic calls it gluten hepatitis or celiac hepatitis. No, more often they say gluten hepatitis because you don't have to have celiac. That can happen without celiac disease.
So the Mayo Clinic is talking about this, but yet I'm thinking as I'm listening to you speak, how little of this is getting out, which is the main reason why I did this event. This whole idea that if people are so concerned about their liver health and they even get diagnosed with a liver problem, conventionally speaking, how many people are being told in the office, hey, let's look at your gut. Let's look at the kind of stuff that's going into your body that is causing all this inflammation, this fire inside of you, that's raising your liver enzymes, on and on and on. Really simple, common sense stuff, according to you and me. But these people are not hearing this kind of stuff.
It's really important to understand that by the time you get symptoms, things are pretty far along. And all of us want relief from our symptoms. There's nothing wrong with that. Absolutely not. Of course, you want to feel better. But if you don't deal with the mechanism behind the symptoms, it's going to manifest somewhere else more aggressively. And the current statistics, as of this year, the Alzheimer's Association came out just recently and said 1 out of 3 elders dies with dementia. That means in this room today, there's 4 of us in this room right now, at least one of us will die with dementia. And that's very scary, very, very scary.
You have my attention, Tom, because I lost my father to Alzheimer's. I mean, of course, they never spoke to him about any of the chemical sensitivities. He was exposed to a lot of chemicals, certainly wasn't very mindful of his diet, loved sugar, all this pro-inflammatory stuff. Of course, what did I know? I would try to talk to my family about these things, and I was a nut job.
Right.
But you definitely have my attention, and I'm sure millions of people who are going to watch this message. Why don't we talk a little bit about exactly how gluten, let's get into that now, gluten and wheat, or I should say, where does gluten come from? Is it only wheat? And how this is so destructive on the gut and the liver.
When you have a dirty oil filter, that oil filter is leaking stuff into the bloodstream all the time. That goes right up to the brain and can trigger the inflammation in the brain. That's why there's something called hepatic encephalopathy. Really good Scrabble words. But what they mean is the crud from the liver is causing inflammation in the brain. That's why it's so important to have a clean oil filter. Another reason why it's so important is because it's very, very common that people notice they don't feel well. Their brain's not firing on all 8 cylinders. They just don't feel right. They can't think clearly. No, you can't, because there's inflammation in your brain, and it often is being fed by crud coming from a dirty oil filter.
Yeah, and again, conventionally speaking, something's wrong in your brain only. They don't look anywhere else. They give you drugs to manage your mood disorders.
Here's a really good example about the drugs and things. When you have hepatic encephalopathy, they treat your brain. They give you drugs for your mood or for your brain. But that's just where the symptoms are manifesting. Hepatic encephalopathy is coming from the liver. It's even in the name of the diagnosis. It's coming from the liver, but they're not treating the liver because doctors aren't trained on detoxing a liver, on taking your liver to the quarter car wash and hosing it down. They're not trained on how to do that. But everyone needs to detox. This toxic world we live in today just accumulates more and more congestion in the liver.
So, Tom, let's talk about where exactly does gluten come from, especially for those beginners out there, and why is it so destructive on the gut and the liver, for that matter?
First, the word gluten. What is gluten? It's really the wrong word to use. It was back in the 60s. There was a corporation in America that came up with a new piece of equipment, and it became embraced by everyone. And it made that corporation a household name, and the name of the corporation became an action verb, where you would say, honey, would you please Xerox this? Xerox is the name of a company, but we now know it as an action step to copy something, right? That's what's happened with the word gluten. That gluten is the name of a category of proteins in wheat, rye, barley, rice, corn, quinoa, buckwheat. Many, many grains have gluten in them. So gluten is not the problem. For some people, they have a sensitivity to corn or to rice, but gluten is not the problem. The gluten proteins in wheat, rye, and barley are the problem. So, and that's why people can get confused at times by the word gluten. So a better word to use, And I don't know that it'll ever happen because Xerox is in the culture now, and so gluten's in the culture. But a better phrase would be a wheat-related disorder. It might be celiac, it might be non-celiac, but we call it gluten sensitivity. But I just like to always say that because people will get confused out there when they start reading things.
No, you must be shaking your head. I'm just laughing inside about you going to a supermarket and seeing gluten-free water. Like everything's gluten-free now.
Right. That's it. It's really being taken advantage of by some companies. That's true. So, what is it about these proteins in wheat? Maureen Leonard at Harvard, very famous gastroenterologist, published a review of the literature in about a year and a half ago. And she published it in the Journal of the American Medical Association, the #1 journal in the English language. You get something published in there, and it's been reviewed and torn apart and looked at to make sure it's all accurate. And she says right in there that many studies, multiple studies demonstrate that all humans develop intestinal permeability every time they're exposed to wheat. There are many studies on this. Every human gets a transient leaky gut whenever they're exposed to wheat. That cheesecloth and the inside lining of the intestines, you have toast for breakfast, you tear the cheesecloth. But we have an entire new body every 7 years. Every cell in your body regenerates. Some cells very quick, like the inside of your guts every 2 days, 3 days. Some cells are very slow, bone cells are slow, brain cells are slow, but every cell regenerates. So you have toast for breakfast, you tear the lining of the gut, but it heals. You have a sandwich for lunch, you tear the lining of the gut, but it heals. Croutons on your salad at dinner, you tear the lining of the gut, but it heals. That's what transient intestinal permeability means. Day after week after month after year until one day, you don't heal anymore. That's called loss of oral tolerance. We can't tolerate this food anymore. It's a minor irritant. Wheat is a minor irritant until you lose tolerance. Now you don't heal anymore. When you don't heal anymore, toast for breakfast, tear the lining of the gut, now you got leaky gut. When you have leaky gut, remember I said earlier that when we eat food, our enzymes break it down smaller and smaller and smaller. When you have a leaky gut, food that you've eaten that's being broken down, and by the way, that's why our intestines are 20, 25 feet long, is because it takes a whole lot longer to digest and break down prime rib than it does a banana. So as the food's going down, being broken up, getting smaller and so until it's small enough particles to go right through the cheesecloth, but up there towards the top of the gut, now if you got a leaky gut, these larger molecules get through into the bloodstream. Those are called macromolecules, big molecules. They get into the bloodstream, and where do they go? Right to the liver. And the liver, which is an oil filter, has got to filter all that stuff and get it out of the body. And how often do you eat wheat? Toast for breakfast, sandwich for lunch, croutons for dinner, pasta, lasagna, pizza, cookies, let alone all of the hidden exposures to wheat and to gluten in your lipstick.
Tom, it's important to jump in for a second. The macromolecules that you're describing, all of those are more like a red alert to the body, right? To be really clear, we don't want that.
Oh, they activate the immune system. Because your immune system, trying to protect you, says, what is this? I can't use this molecule to make new brain cells or bone cells. I better fight that thing, whatever it is. And then your immune system makes antibodies to fight whatever the molecules are. That's a person that does a 90 food panel with their doctor to see what foods they're sensitive to, and they're sensitive to 25 different foods. Oh my God, that's everything I eat. Well, of course it is. Your immune system's trying to protect you. So thank God your immune system's trying to protect you from this. So wheat causes a tear in the cheesecloth for every human, every time you eat it. So for everyone that's listening to this, if you are human, this is you. You may not like it, but if you are human, this relates to you. And when we cross that threshold of oral tolerance, and that can be when you're 2 years old, 22 years old, 92 years old, whenever you cross that threshold, now you activate the gasoline on the fire concept in your bloodstream, causing inflammation that can affect your brain or your thyroid or your skin or your heart or your lungs, wherever your genetic vulnerability is.
Tom, I know you've been subjected to this plenty already, but I have to ask you. So there's a lot of people out there, let's face it, who are listening to this message right now. They're not in pain, and they may not have necessarily been diagnosed with any kind of serious disease at all. And then you still have that same group of people who've heard that, say, brown rice or more of a high carbohydrate, grain-based diet has helped them to heal many diseases, right? You're here, you're the expert. And that, I think, inherently is what's creating this confusion still, because I'm with you 100%. I've seen in my own personal life how this is absolutely true. You get to a certain point, the analogy I've used a lot in my conversations are that you get to the top of the bathtub, and now all of a sudden, one sandwich will be a problem, right? Before that, listening to Tom's message, come on, how could one thing?
Fine.
I'm fine. Right back to what you said. I can't believe you. Now I'm 100% on board. It absolutely is something that I feel a lot of people at a certain point in time are going to have to deal with. But what do you say to those people out there that say, then how on earth did these high carb, eating bread and eating these grains, how did they heal?
That's really a question. There are a lot of good components in wheat, lots of good components. It's 20 to 50% of all the calories in the diet in temperate countries. 20 to 50% of everything they eat is wheat-based. It's enriched with B vitamins, there's iron and zinc and selenium. There's lots of good components in wheat. It's the proteins that are the problem. So grains in general are really good for some people. There are hundreds of studies showing the benefit of eating grains. And there are studies that say for some people, grains aren't such a good idea, right? That's why you have to find out for yourself with the help of a good coach as to what kind of an eating style you put together. The problems with wheat are manifesting in more and more people because of the overwhelm, the loss of tolerance that's occurring in our bodies today. Most every degenerative disease is increasing. Most every cancer, deaths from breast cancer in the last, I believe it's 15 years, are down 1%. Deaths from prostate cancer are down 7%. Deaths from strokes are down 14%. Deaths from Alzheimer's are up 123%. And it's getting worse and worse. And 1 out of 3 elders now in the U.S. will die with dementia. That's the statistics. We're getting sicker and sicker as a people. Why is this happening? The big picture view of why this is happening. The Toxic Substance Control Act of 1976 is the regulating guidelines still in effect today for chemicals introduced into our environment. And the industry was very successful in developing a passing legislation that has no teeth. And in 40 years, the TSCA has only regulated 5 chemicals or classes of chemicals. And there are thousands that are introduced into our environment every year, thousands. There's no science that these things are safe. The companies do not have to prove they're safe. Let me say that again. The companies do not have to prove they're safe. And people listening will say, oh, that can't be true. Our government protects us. No, they don't. There are no regulations governing this. And the amount of chemicals introduced or manufactured in the United States or imported in the United States is 27 trillion pounds per year. Now, that's a number that no one can relate to. But take the population of the United States and divide it by 27 trillion, it's 247 pounds of toxic chemicals per person per day that are being imported or manufactured in the United States. All doctors know that every newborn baby today has over 200 toxic chemicals in their bloodstream, 200 chemicals in their bloodstream at birth, many of them toxic, that are not supposed to be there at birth.
Tom, some of the other confusing messages that people are getting, this is staggering information you're already bringing out, but so many people are still getting the message all the time. It's just, I'm sure you've heard it, it's just a little bit of this. It's just a little bit of that.
That's exactly right. And here's how I respond to that. How many people do you know whose lives have been saved because they were in a fire, but they were sleeping under flame retardant bedding? I've never heard of anyone. But these sheets and these comforters and these blankets that have been soaked in these chemicals, they outgas these chemicals for years. But there's no evidence that the amount of chemicals absorbed from flame retardant clothing is toxic to humans. There is no evidence of that. Absolutely none. And that's how they get away with it. But this stuff is accumulative in your body. It's the accumulation over years. Let me give you an example. 346 women in Chicago, pregnant women, they collected the urine in the 8th month of pregnancy, and they measured them for phthalates, the category of chemicals used to mold plastics. And there's one that many have heard of, BPA, or bisphenol A, in water bottles and things. They measured 5 phthalates in the urine of these women. Now, there are many more, but they just measured 5 of them. They put them into categories, the lowest, the next category, the third, and the highest category. They followed the offspring of these women, the children, for 7 years. When the children turned 7 years old, they did Wechsler IQ tests on them. Now, there's not much in medicine that's all or every. This was an every. Every child whose mother was in the highest quartile of phthalates in urine in pregnancy, compared to the children whose mothers were in the lowest quartile of phthalates in urine in pregnancy, every child in the highest quartile, their IQs were 7 points lower than the other kids. 7 points. Now, 1 point is noticeable. 7 points is the difference between a child working really hard, getting straight A's, and a child working really hard, getting straight C's. They just don't have the circuitry, because phthalates, these chemicals, inhibit neurogenesis. That's a geek word, but it means brain growth and development. So these drugs in the bloodstreams of mom that get into the bloodstreams of baby in utero affect the growth of the brain. These kids' brains don't develop the same as the other kids. And at 7 years old, these kids can't think anywhere near the way these other kids can. That's an example of the phthalates and of the chemicals that we're exposed to. Now, remember I said wheat or gluten is a problem, loss of oral tolerance. Why do we lose tolerance? It's because of all of these chemicals in the environment that we're being exposed to. It's in our food, it's in our water, it's in the air, and all of these things that we eat, these chemicals we get, they get into the bloodstream. Where do they go? They go right to the liver. And your liver has to filter all this stuff, trying to get it out of there.
Also, to be clear, Tom, for sure, in the 40 years you've been teaching people about the dangers of eating wheat, and most specifically the proteins that we're talking about today, how different is the processing of our food now compared to 20, 30 years ago? Yes, all the chemicals in our environment, but just wheat alone, I know, has gone through major changes in terms of specifically how they dry the crops before harvesting most of this conventional wheat. by spraying it with glyphosate, which is just a horrific thing, but in modern farming mindset, this is a great idea. Let's dry the crops with this chemical spray, and it'll make it easier to harvest. That has to be really adding to this when we see all the bagels, the chips, the sandwiches, the cookies, the crackers that so many people are eating. And then there's this whole concept of bioaccumulation. Let's not even go there, right? When it comes to conventional medicine, I don't feel like they recognize yet that a little bit of this, a little bit of that is genuinely building up in our system.
Oh, right. They don't. And that's a very good point about the hybridization of wheat. And that's true. Wheat's been hybridized so farmers can grow more tonnage per acre. But it hasn't changed the protein structure that much to make it more antigenic. And the glyphosate that's now on much of the wheat in our country hasn't changed the protein structure, but it makes it more toxic because of the chemicals, right? And the glyphosate will impact on the microbiota in our gut in a terrible way, and that's a whole discussion we can get into. So the altering of wheat by the farming practices is, it's made it worse. It has made it worse, but the primary, and if there's a takeaway for everyone who's watching this, the takeaway is that it's the accumulation of all of the toxins that are making us more sensitive to wheat and to other foods, but to wheat than ever before in history.
And certainly when you look at the type of foods that people are eating, it's not funny. It is very much, at least here in the United States, very much centered around wheat products, even if people feel like they need to look at it, that they're eating such different foods. They're really not.
50% of the calories in the American diet are from wheat. That's the average, 50%. And once you've crossed the line of tolerance and you're susceptible to this, now every time you eat something with wheat, it's gasoline on the fire. And if the weak link in your chain is your brain, you get more inflammation in the brain. If the weak link in the chain is your thyroid, you get more inflammation in your thyroid. And here comes autoimmune thyroid diseases. If the weak link in the chain is your skin, you get psoriasis or acne or rosacea. If the weak link in your chain is your bones, you get osteoporosis. And we go on and on and on. There's thousands of studies on this now. So wheat is not bad for everyone. Some people have tolerance for it, but the vast majority of people now do not have tolerance any longer. And it's simple to find out. You just have to do a blood test. And if you do the blood test, and you have to do the right blood test, a comprehensive blood test. It's called the wheat zoomer, because you zoom in on the problem. That is the most comprehensive blood test in the world today. I travel all over the world to teach, and so I look at the laboratory offerings the doctors have, what kind of lab tests are available in every country, and there's nothing like the wheat zoomer. It's the most comprehensive test out there.
Tom, your aunt had some story about the liver, right? Tell me about it.
Yeah, my godmother. Yes. I got a phone call one day. Aunt Emily's on the way to the hospital. And I said, "What's wrong? What's wrong?" "We don't know. Some kind of stomach pain." Now, my godmother, she was 82 at the time. Her health history, she was in the hospital 3 times in her life, 2 natural childbirths, and a car accident in her 60s that broke her hip. She was in the hospital for a week. Never had any medications except for pain medication after the broken hip for a little while. Every year she'd go to her doctor. I'm half Italian. This is my Italian aunt, my godmother. And she'd go to her Italian doctor and he'd say, "Emily, you're as healthy as a horse, but you have to stop drinking," because she had mildly elevated liver enzymes. And she'd say, "I don't drink." And he'd go, and then go on to something else, right? Just ignore her. But Aunt Emily never, ever drank, ever. We'd be at a wedding and everyone's toasting the bride and groom, and she would take a glass of water and toast the bride and groom with love and good wishes. And then after the bride and groom would kiss, our family go, "Hey, you old woman with that glass of water, what are you doing with the glass of water? You don't belong here. You need to leave." And we go, "Emily, Emily, Emily." And she goes, "Tacito," which means shut up. And the other side of the family go, "Who is, what is this?" Right? But she never drank. Next year, she'd go to her doctor. "Emily, you're as healthy as a horse, but you got to stop drinking." And she'd say, "What's the matter with you? I told you last," that's how she talked to her doctor. "What's the matter with you? I told you last year, I don't drink." And he'd go, Because doctors don't know what to do with mildly elevated liver enzymes when they don't have any other indicators of a liver problem. They don't know what to do, and usually it's from increased alcohol content. Your body can't break down the alcohol. So now, fast forward, now she's rushed to the hospital. And finally, what happened? Turns out she has sclerosis. 96% of her liver is completely scarred, like a severe alcoholic. 96% of her liver. Because liver enzymes are a measure of dead liver cells. Now, your liver is making enzymes all the time, and there's a normal reference range. And when you do a blood test and your liver enzymes are in the normal reference range, you're making as many new cells as you're losing, because enzymes kill cells, break down cells. But when you have mildly elevated liver enzymes, you're losing more cells than you're making. And this went on year after year after year after year, but she felt fine, never had any symptoms. So rushed to the hospital, 96% of her liver is completely sclerosed, scabbed. Well, all the blood in the body goes through the liver. Now, all the blood in the body is going through 4% of the liver. But 100% of the blood is trying to get through 4% of the liver. What happens in an 82-year-old frail woman, like most 82-year-old women? What happens to her blood vessels when there's all this pressure from blood trying to be pushed through, and tiny little blood vessels, but a whole lot of blood trying to get through? What happens to the blood vessels? They burst. Internal hemorrhaging. Severe pain. They rush to the hospital. They find out she's hemorrhaging. Emergency surgery, save her life. So fine, I call. What happened? When they tell me, I told my cousin, her daughter, I said, "Have this blood test done. Transglutaminase and deaminated gliadins." And she said, "Well, why would I do that?" And I said, "Because it's a simple blood test, but it may tell us why her liver got sclerosed." Because I knew that celiac disease would sclerose the liver in many people. So my Aunt Emily had 6 emergency surgeries in 8 weeks. The blood vessels keep bursting. What are you going to do? You can't bypass the liver, and the blood's got to go through the liver, but she was already in the hospital. Then all of a sudden, crash carts and emergency surgery. And I asked in there somewhere, I said, "Cindy, what happened on that blood test?" And she said, "Oh, Tommy." They call me Tommy in Pittsburgh, right? "Oh, Tommy. The doctor says you're probably a nice man, but you don't know what you're talking about." What? What's his name? So I called him, and I couldn't reach him. He's always in surgery, but I got his voicemail. And I said, "Doctor, thanks so much. This is Dr. Tom O'Brien. Thanks so much. You've saved my godmother's life 6 times. Way to go. Really appreciate it. You certainly deserve your reputation as one of the best. But I understand that you refuse to do this blood test. Now, you're a hepatologist. That's a liver specialist. Do you ever read the journal Hepatology? Did you read November of 2007, where Mayo Clinic, in the article, "The Liver in Celiac Disease," says that mildly elevated liver enzymes may be the only indication of a problem with wheat? Did you read that? Well, obviously he didn't, because he didn't do that blood test. Or that you completely reverse mildly elevated liver enzymes in 90% of the people on a gluten-free diet. Completely reverses it. It's called celiac hepatitis or gluten hepatitis. Or that 54% of children and 48% of adults, when diagnosed with celiac disease, have elevated liver enzymes. Did you read that article? No, he didn't read that article.
I'm wondering if this message got his attention or
Well,
not.
I'm hoping it did. I never followed up with them. Or that people with cirrhosis, like my godmother, have an 8-fold increased risk of death if they also have celiac disease. So finally, after the 6th surgery, the surgeon said, Emily, go home and make your peace. I can't do any more surgery. Your blood vessels are paper thin. She said, how long do I have? We don't know, 2 weeks, 2 months, we don't know. It'll be quick. So Aunt Emily went home to die. That's when I went to Pittsburgh to say goodbye to my godmother. You ever say goodbye to someone that's known you longer than you've known you? You know, I still have the blanket that she knit when my mother was pregnant with me. It's white and blue and pink because in 1951, they didn't know, boy or girl, right? So I guess I've got a pink blankie, right? I've given it to my goddaughter now, or my granddaughter now. So I went to say goodbye. I stayed 3 days. I wake up early every morning, so I went out in the living room one day, and there's my godmother sitting on the sofa. I said, Emily, what are you doing up so early? She said, I can't sleep. I said, lay down. And I had brought a barrel, a needle, and a tube, and I drew her blood. I called the lab. I said, this is Dr. O'Brien from Chicago. Come get this blood now. My godmother is a celiac. So that night, I had a meeting with her and my uncle and the family, and I showed them the test results, and I had my laptop. I showed them the article from Mayo Clinic, the liver and celiac disease. And I said, Aunt Emily, I don't know how much time you have. They said 2 weeks, 2 months, I don't know. But I promise you're going to have more energy. I promise. And because she was really tight. 82-year-old woman, 6 major surgeries in 8 weeks, right? She said, okay, Tommy, okay. Don't ever eat wheat again. Uncle Mario, don't you make that pasta anymore. You know, we make our pasta from scratch. I'm Italian, you know, we grew up with this. And I brought some rice pasta with me. I said, make this. And so we had rice pasta that night with their sauce. I said, oh, Tommy, this is okay. This is okay. Good, good. And Emily didn't eat wheat again. She didn't live 2 weeks. She didn't live 2 months. She lived 1.5 years. Now, no doctor can explain how a 82-year-old woman that had 6 emergency surgeries because of blood pressure was bursting the blood vessels in the liver, all of a sudden it stopped. I can explain now, and now I know the physiology because I've read the studies about how it affects the blood, and now I understand it. And I'd call every week, multiple times, say, hey, Anna, Tommy, where are you? Well, I'm in Seattle. He's in Seattle. And in the background, there was always a bunch of noise because the family was there every single day. Every day. They'd bring food over, the grandchildren would come do their homework there, because Aunt Emily might die today. She might die tomorrow. It's really weird when every time you talk to somebody, you know it might be the last time. It's really strange. So, and you know, she'd get up from the lazy boy to go get a glass of water. She'd stand up and they say, what are you doing? I'm getting a glass of water. Everybody jump up and she'd say, sit down, sit down. If I die, I die. Sit down. You know, it's just a whole strange, different world. And then she called me one day and she said, Tommy, I have liver cancer. And I said, I know. How do you know? Well, it happens with this condition, Aunt Emily. Why didn't you tell me? I said, what for? You're going to die anyway. Why should you worry? And she said, what should I do? And I said, I don't know. I'm not an oncologist, but I'll find out. So I called her oncologist and asked, what do you want to do? What's a recommended protocol? And I had to have him spell the name of these drugs because I don't know chemotherapy. But I spent 2 days. Everything stopped for me. 2 days to find out about my godmother, you know, this treatment. And I called her back and I said, Aunt Emily, there's no evidence you'll live an extra day. Not one. You'll be sick, throw up, lose your hair, feel lousy. You might die from throwing up, you know. So I don't know. I wouldn't do it, but whatever you want. If you want to do it, I'll help you as best I can. So she didn't do it. So the cancer grew and it spread. And then I got a call. I was in South Dakota. I was on stage in South Dakota. And it was the break, and I saw Pittsburgh get called. So I called, they said, any day. No, any day. So I came back on stage after the break, and I said, I'm sorry, I have to leave now. I'll make it up to you. Someone I explained, and everyone was very supportive. And I flew to Pittsburgh, and there was my godmother in the hospital bed at home. She weighed 53 pounds. The cancer had eaten her up, completely eaten her up. So I'm sitting by her side. My head's in her lap, and I'm crying. She's brushing my hair. When I tell this story, I feel her brushing my hair. And I lift my head up, and I look her in the eye, and she's crying. And she said, "Thank you, Tommy." Now I'm really sobbing. And then she gets her fire in her eye, this fire. And she said, "You tell him. You tell him." I said, "I will, Aunt Emily. I will." That's why I flew here today, Jonathan, is because my job is to tell people. They're not going to read the science. They're not geeks. But just look a little at this and you'll see everything I'm saying is right on the money. It's not my idea. It's the science. This is one of the things that's killing us. And it is so prevalent. Now, with the tests that are available, we find, and doctors find this all the time, 7 to 8 out of 10 people, when you do the right test, you see your immune system is fighting wheat. You've lost oral tolerance. And wherever your genetic vulnerability is, wherever the weak link in the chain is, that's where you're going down. And wheat is just accelerating the process of degeneration to your kidney or to your liver or to your heart or to your brain. That's why wheat is such a problem for so many.
Tom, I know you've come a long way. I didn't mention it at the beginning, but I'll mention it now. You get the award for the person who's traveled the greatest distance to be in this studio from Italy. So thank you very much for being a part of this event. I really do appreciate it, and I hope people get a lot out of this conversation.
Thank you, Jonathan. It's by events like this that people can get the information to protect themselves and their families from the misinformation that's out there. So thank you.
Thank you. I hope you enjoyed day 5 of the Fatty Liver DocuClass. Stay tuned because we still have 2 more days and the best is yet to come. By the way, if you'd like to own a copy of all these episodes, plus all the other presentations that we're offering inside the Fatty Liver DocuClass, simply click the link below and choose the package you want, including some really valuable bonuses. Talk to you soon. Take care.